Hi guys, so I know you sent me a lot of messages the day when I did my Ask Me Anything, and there were so many questions that popped up. I did answer at least 15, 20, but there were so many more. I don't know why you all want to know about my life. I'm an extremely boring person. My life is really limited just to my work, my family, my partner, and that's about it, and my friends. So there's not much that I do, but I definitely can share some things about you, since we've been communicating on various platforms and probably you don't know much about me. So I'm just going to take three more questions that you asked me. So the first thing you asked me was, how do you maintain the work-life balance? Guys, work-life balance in this field is very hard to maintain. So you need to follow a couple of things. That is, leave your work at home. When you leave your work at your workplace when you come home, and try to not get into that rut. Sometimes, even with your partner or with your friends, if you have like the same conversations about your work over and over again, they don't want to have it, right? So try to talk nonsense things, talk rubbish things. Pucha gaya is, how do I deal with the burnout that I experience in the field? Guys, burnout is something which is a very big term, and it happens over a period of time, right? It just doesn't happen. So if you're facing very heavy cases in your MPhil journey, it's very important for you to remember two things. Of course, take supervision and tell the person who's supervising you in your cases that I cannot, this has happened and I cannot deal with it alone, and they will definitely help you out because they're there for that. Second thing, if a case is extremely heavy, please learn to transfer it. It's okay to say no to a case that's getting very heavy for you, and this can be for any professional in the medical field. Like, sometimes a patient can be very overwhelming for you, and because we have our own traumas, and especially in the field of psychology, psychiatry, where we're dealing with human emotions, sometimes a few things that people say can trigger our own emotions, and it's absolutely normal to transfer a case in those times. There is no hesitation that you should experience here. ये मैं कैसे transfer कर सकती हूँ? I'm not a good clinician, I'm not a good professional. There is nothing like that. You're doing something good for yourself, you're doing something good for your patient by transferring the case to somebody who might be more comfortable in handling that case, nothing else, right? So burnout can only be dealt in these two ways. And of course, apart from that, your rejuvenation, your recreational activities, you going out, taking walks, doing mindfulness based techniques. I personally practice all of this, and it's very good. Exercise on a daily basis, eat better food, like it's very important. Like, today I just had something very rubbish, so I was really judging myself for this, but usually I do not, because packaged food and all of this is not good for our body. We need to give ourselves healthy food. Already in the healthcare profession, we do not have a very good work-life balance, because there is so many long hours of work and there is no proper sleep. So if the diet is also not maintained, it's going to affect us in the long term. So try to maintain your healthy gut and a good, have like good food and good lean meats. And if you're a non-vegetarian, if you're a vegetarian, try to give yourself the right amount of protein that you require, and try to keep the gut clean. It's extremely important. I know it's like a very thing. It's actually very important, because everything starts from there. Exercise, have your routines, do everything in moderation, and go outside also, like recreate, like don't just like keep working all the time. Like, it's not going to work, it's not going to get us anywhere. We're going to get the license anywhere at the end of the day, because we're completing our number of hours. So there's no point doing extra work and troubling your body. And that's the only way to deal with burnout. And the moment you feel that something is getting extremely overwhelming for you, take a break from it, be it anything. So that's what I have practiced, that's what I use. These are my tips that I have used in the past 1 year, and trust me, I feel burnout a lot of times. It happens over a course of time, but when it happens, it breaks you completely. And especially in our field, because there are human emotions involved, you need to be even more careful, right? A couple of opportunities in the field depending on the kind of area that you want to specialize in. Clinical will give you more opportunity only in the sense that you can also work in healthcare setups, and you can also work in corporates, and you can also work in schools. So there's like a very vast plethora of opportunities that opens. But apart from that, all the fields of psychology are equally important, and they're equally good. So there is no good or bad, there's just what you decide to do. And if you want to take up extra studying and extra toiling, and if you're interested in diagnosing and assessment related work, then clinical works very well for you. Apart from that, I don't think there are many differences in the field. Like, it's just the kind of area that you're specializing in. If you want to be a healthcare worker, then you should go for clinical psychology. If you are okay with dealing with employees and like and salary basis also, people have asked me. I said it really depends in this field, because it's not that if you do clinical psychology you have like a skyrocketing salary, or like your salary will skyrocket, or if you're like doing industrial, like it will be less or more. It's not like that. It really depends, right place, right time, right contact, and how much experience you have, and ultimately how well you're doing as in the role that you're in, right? Like, that's extremely important. But yes, there are a few things that are extremely important for a good psychologist, like communication, empathy, listening skills, understanding of what your patient wants, from where your patient is coming. So if you feel that those are the things that you do have or you can build on, then that is the right field for you. So when you're picking the field of psychology nowadays, people just take it, like, you should be sure of what you really want to do, and your money will follow. If you have all of those skills, the skill set is right, and you're at the right place at the right time, money is anyways going to follow, so you don't have to worry about that too much. Anything else you need tips and tricks on as a practicing clinician or somebody who is in their journey to becoming a psychologist or a healthcare professional, you can reach out to me. Thank you.